Hi, I'm Dr. Michael Wright. My main role at the moment is I'm President of the Royal Australian College of General Practitioners. I'm a GP. I've been in practice sort of over 20 years. I worked in Queensland, worked in the UK, now been in Sydney for the last 10 years, and I'm now an Associate Professor at the International Centre for Future Health Systems. But prior to that, I was a health economist working at the Centre for Health Economics Research and Evaluation at the University of Technology in Sydney. We know that more than 22 million Australians see a GP each year, but often it's uncertain what the outcomes of the care that we provide are, particularly to policymakers and funders, and that's an important oversight. And it's not helped by the fact that less than 2% of health research funding goes to primary care. What this consortium will do will provide more resources for allied health providers, general practitioners, and the whole primary care workforce and infrastructure to work together to understand how we can deliver care better. Look, it's a mouthful, the name of the consortium, but it's a big consortium and it's dealing with a big issue. So what we've done is we've brought together over 100 researchers in primary care who are working together from 20 different universities from around Australia who are looking at what are the challenges that we're facing with delivering primary care in the community. So I'm a GP, and the focus for the RACGP is looking at how general practice might interact with the other health professions, other health providers, allied health professionals within primary care, and how we work better together, and how we also might work in delivering primary care across the broader health system and the interface between primary health care and the other care. I think the real urgency and need for this consortium is we know that primary care is often overlooked in terms of health funding, and we know that only 2% of NHMRC funding goes into primary care. What we've also included is 30 stakeholder groups, of which the RACGP is one of them. And so the RACGP focus, and my focus as a GP, is to make sure that we bring this together so that we do get the input from general practice. We know that nearly 90% of Australians see a GP every year, and that's where the majority of general practice and primary care occurs. So we need to make sure that there is active GP involvement, but that we also work with other providers. So we recognise there are a lot of other allied health professionals providing important primary care and a lot of stakeholder groups. We know there are challenges in our health system. We've got a growing population, an ageing population, and people are increasingly living with chronic and complex conditions like diabetes or asthma or depression. And often they're living with multiple conditions. And that means the care that we're providing in general practice is getting more complex. More of our healthcare is being provided in the community, and that's a good thing, but we need to make sure that it's better coordinated and that we are providing the best care that we can, and we need to do some more research to understand how it can be better delivered. One of the ways we're looking at this is by looking at multidisciplinary care teams, and that's a type of care that is familiar in many general practices where you've got multiple professionals working together to get the best outcomes for our patients in the community. Another initiative which we're looking at is around practice-based research networks. And so this is a chain of, or a network of practices in primary care around Australia. And we can use insights from those practices to do some better research to understand how care should be delivered. Practice-based research networks are a really great idea which we've seen successfully implemented internationally. And they help us gain greater insights about what type of care we're providing in general practice and also in primary care more broadly. But it's also a better mechanism for funding so that we can actually provide research to researchers in the general practice setting and get outcomes. The really important thing about this program is that it'll actually shine a light on the care that we're providing in primary care. It'll help us evaluate how health policy is being experienced by providers and by patients. But more importantly, hopefully we can design better policy so that it best meets the needs of our community, provides value for money, and makes sure that health professionals are working to the full of their ability and collaborating well.